Okay, so I'm going to look at a couple of different views of the skull, and I want to point out a couple of important things. One of the things that can be confusing is where and when you can see the sphenoid bone. So this is an anterior view, or looking at the posterior portion of the eye sockets, and you can see the sphenoid bone with the on either eye socket, the right and the left eye sockets, and here is the superior orbital fissure for the left and the superior orbital fissure for the right. Laterally, you can also see the sphenoid bone. The sphenoid bone is between the the zygomatic bone and the temporal bone. So it's in between the zygomatic bone and the temporal bone. Inferiorly, you can also see the sphenoid bone. Rotate this for you. So the sphenoid bone, this portion right here is the mandible. The mandible may or may not be around in the jaw that you're looking at. So just be aware of that. This is the roof of the mouth. There's the maxilla. Posterior to that is the palatine bone. So that's the posterior portion of the roof of the mouth. And then posterior to that is the ethmoid bone. So the ethmoid bone is another slightly less complicated bone than the sphenoid bone. Posterior to the ethmoid bone is the sphenoid. Sphenoid is a very interesting bone, and it's really easy to get students get confused with when they're taking a practical. So another view that I'm going to try and replicate, it's not going to be a perfect replication because I can't remove portions of bones. I'm going to remove the major bones of the skull, and including the frontal bone that I've just removed, and the left and right parietal bones. So now the right and the left parietal bones are now removed. And now we're going to look at what the skull looks like from a superior view. And now, the view that you'll see is going to have this superior portion of the occipital bone will be sawed off. A little portion of the parietal bone, the inferior portion of the parietal will be sawed off, will be present rather. It will come around here, a little bit of the frontal bone meeting with the other parietal bone. So that's a slightly different view than what we're looking at here. But in any event, you have the foramen magnum here on the occipital bone. Lateral to the occipital bone, you have the right and the left temporal bones. And then anterior to both of those, you have the sphenoid bone. So this is the fourth view that you can see the sphenoid bone in. You can see it anteriorly, inferiorly, and laterally, both on the left and the right side, and now superior. Another bone that's in the central portion of the head is the ethmoid bone. The ethmoid bone is just posterior to the nasal bone, and it has two parts to it. The plate right here that the mouse is identifying or pushing on. The plate is the cribriform plate, and then these are the crista galli. Going back to the sphenoid bone here, you have the upper wing of the sphenoid bone. The lesser wing is superior. The lesser wing is would be very easy to ask for in this case on this bone. Okay, I'm going to stop right here.